what I like to do tonight is be able to help you understand a more broad viewpoint of immunity and some autoimmunity tonight. But it's important to recognize that what you're doing can be combined with a number of other paradigms, and it can be extremely useful in terms of patient care. I think it's also important to recognize that there are other paradigms that you could use that you don't have to necessarily be expert at, but knowing that they're there and being able to use them becomes an important aspect of how to manage your patients. But I think it's also important to recognize that immunity and autoimmunity are also related to the major issues that we see today in the initiation of complex chronic disease. That becomes immunity. It's the immune system that creates the inflammatory response. And the inflammatory response results in people getting oxidative stress. You get these free radicals, the reactive oxygen species. That's why we take antioxidants. And those damage cells and affect DNA and affect a lot of different systems. If you have chronic inflammation, we used to think there were certain areas that were impenetrable to these kinds of inflammatory responses. We used to say, oh, the brain is always protected because there's this blood-brain barrier. Now we know that the blood-brain barrier is subject to changes related to inflammation. And these cytokines can actually cause inflammatory brain problems, which is why you see people with things like Lyme disease and different kinds of autoimmune problems having cognitive and brain-related memory issues, emotional issues, things that affect them because our immune system is not sequestered in little areas. It's more like once it gets started and the body says, we have an ongoing problem here and it's not local, we better do something about it. So they travel and they affect it. And the kidneys in Ming Men produce yin, they produce kidney yang. It affects the bone marrow per se. And we have the catecholamines, our adrenals. They produce, one part produces catecholamines, one produces corticosteroids. The catecholamines are stimulants. And the corticosteroids are anti-inflammatory. So that's that fight and flight. When people are done with this and are recovering, their immune systems are going to be hammered. And you're going to find that you have a place in strengthening back up, because boy, if the next wave comes, you want that Wei Qi and nutritive Qi to be working so that they can do well. And, really talk to your patients more, see what they need, and then figure out the priorities of what's going to work